Hey everyone, my name is James Free. My job is currently a senior growth strategist at Portneuf Medical Center in Pocatello, Idaho. I've worked in healthcare for about 11 years now. My current role centers around driving hospital growth through strategic outreach, provider relations, and community engagement, especially within our rural markets out here in Idaho. I work directly with about 130 employed providers, and our medical staff has about 400 individuals. And we also work closely with about 16 critical access facilities. Our goal is to ensure that patients in the region are connected to the right care at the right time. My proudest achievement in this role has been designing a strategic transfer program that has led to a 20% year-over-year increase in patient transfers to our facility. Before stepping into my current role and kind of in this hospital space, I spent several years managing an orthopedic practice where I oversaw everything from operations and recruiting to budgeting and marketing. I've also held roles in international business development and have had the opportunity to teach college courses earlier in my career. All of these different experiences, both across private practice, hospital administration, and my education, have shaped my view of leadership in meaningful ways. Outside of work, I'm a husband and a father. Spending time with my family is probably what brings me the most joy. We love being outdoors. We love camping, hiking, side-by-sides, motorcycles, just any way to get out and enjoy Idaho's beauty. I'm also a huge sports enthusiast. You'll oftentimes find me catching a game or staying active playing sports whenever I can. When I think about leadership, I don't just picture someone giving direction. I picture someone who builds trust, creates vision, and is able to effectively connect people to purpose. Leadership to me is about empowering others and building a system that can sustain momentum long after you've left your position. Over the years, I've come to realize that great leadership is less about having all the answers and more about asking the right questions. It requires someone that can listen well and recognize strengths in others. I have seen firsthand in meaningful relationships, and not just structures, but those relationships actually drive performance and engagement. Whether I've been leading a team of clinical staff or working with physicians, sometimes even collaborating with different administrators, I've learned that transparency, consistency, and humility go a long way in establishing credibility and inspiring people to rally around a vision or a goal. I also believe in adaptive leadership. Healthcare is ever changing, and we have to be steady and flexible. During COVID-19, I had to step into new roles within my job description, helping coordinate with public health officials and really shifting our outreach strategies literally overnight. That experience has reminded me that the ability to stay calm and think creatively and keep others focused during uncertainty is an essential part of effective leadership. Above all, leadership is all about responsibility. It's not just an organization's goal, but it's about people and missions. It's also about stewardship, caring deeply about the teams that you lead, the communities you serve, and the legacy that you leave behind. That, for me personally, is the type of leader that I want to be. As I begin this course, I'm excited to deepen my knowledge and sharpen my leadership skills and continue to learn from those around me. That's you, my classmates. My goal is to be more than just effective. I want to be strategic and impactful at a system level. I'm especially looking forward to exploring new tools for data-driven decision making. Organizational leadership is very interesting, and also looking further into healthcare innovation. Ultimately, I hope this program prepares me to lead in a more visionary, informed, and connected way, whether that means expanding access to care in rural communities or driving operational excellence or simply mentoring the next generation of healthcare professionals. I'm excited to get to know all of you and grow together as we learn to lead change in our own areas of healthcare. Thank you.